So today we're talking in our teaching class about how to present and especially how to use the PowerPoint most effectively when you're giving a presentation for grand rounds. And I would say the very first thing you need to do is have an outline that you know what you're going to say it, and then end with the conclusion slide. But as opposed to normal papers and where you're giving away the answer right away in the title actually can serve as a teaser to kind of bring the audience in without giving them the actual diagnosis. And so we try and have a clever title that would engage the audience and give them a clue about what's to come, but not necessarily give them the answer. So, for example, if we're talking about a thrombosis, we might say a lot of clot to use the alliteration, or we might give a little bit of a teaser by using a Latin term or some pathologic term that they may or may not be familiar with, so that they know at the end that there was a connection with the title at the beginning. And the first slide should match to the focused stem, and you can watch the video on what a focused stem looks like. And intentionally, the focused stem should focus the attention of the listener onto what the clinical problem is. So a 20-year-old white female with no past medical history presents with acute unilateral loss of vision and RAPD and a normal fundus. So that would be a very focused stem. And then we would combine the key elements of the pertinent negatives and positives from the family history, the past medical history, the meds, the social history, the allergies, the usual things on the front end. And then we would give the examination. And in general, we want to show things if we can, which is show the visual field if you can, show the optic nerve photograph, show the OCT. Rather than using words, we would like to convey the information with the visual. And as you know, ophthalmology is a very visual field, and so the more we can show and the less words we have to show, the better for the audience in an ophthalmologic grand rounds. And then we're going to show the imaging studies, and my main pearl for the imaging is residents love to pick the imaging study that shows the biggest, brightest thing. But really that's not what we're aiming for. What we should show instead is a representative T1, a representative T1 post-contrast, and a T2 and or a flare signal that shows the lesion in different planes. And so instead of just having one slide that shows the tumor, we would have a T1, a pre-contrast, a post-contrast, a T2, and a flare. And that really could be done in 3 slides. We really don't have to do 50 slides for that. And then if we have the path, the pathology of whatever we saw, that really would be the best, because clinical pathologic radiologic correlation is the best kind of grand rounds to me, because it engages the audience as well as in a multidisciplinary fashion. You can have the pathologist join us, you can have the radiologist comment. And in our society, the North American Neuro-Ophthalmology Society, we call that the Walsh meeting. So at our meeting, the Walsh meeting, we have a radiologist, we have a pathologist, and we show the clinical case, the visuals, the imaging, and the path, and we have a comment on each of those. And the penultimate slide usually should be a diagnostic procedure was performed. Now, it should be path, but sometimes it's a laboratory study, sometimes it's a genetic study. It doesn't have to be path, but path obviously to me is the best, because when we get back to the basics in pathology, we really learn the most about how things work and how diseases work. And then at the end, we'd like to have a take-home message slide that just has 4 or 5 bullet points for the ophthalmologist. What should the ophthalmologist in the audience take home from this talk? So if we conclude with that summary slide, 4 bullet points, I think that'd be best. And so when we're making these slides, we really don't want to have paragraphs. We want to have maybe 3 or 4 bullet points per slide, and if we can fit each bullet point on one line, then it won't have to run to the next line. And so what that means is you can get rid of a lot of the things that don't add anything to the case. The articles, the and all the punctuation marks, the periods. We really don't need any of that, because you're not reading them the slide. You are using the slide to prompt your presentation, and it's really for you to be speaking. It's for them to see it, but really we're using the slide as a prompt. And so less is more when it comes to those word slides. So in summary, what I hope I've given to you is, when we're making the PowerPoint, have a catchy title, give a focused stem, show the past medical history, meds, allergies, etc. Include the pertinent positive and negatives. Have time for pause at each level so that the audience can comment. Show things is better than talk about things. Field, OCT, fundus photograph, way better to show. Show the imaging representative, T1, pre and post contrast, T2 flare, and in different levels. Have pathology or laboratory study or whatever the diagnostic procedure as the next to last slide, and then end with a summary slide with take-home points that an audience member can take home with them and use tomorrow. And if you do that, I think you'll have a better Grand Rounds.